The V-Gel Advanced Airway device can be used for the administration of anesthesia gases and emergency or supplemental oxygen in an unconscious dog. Ensure that the patient is fully anaesthetised to a surgical plane of anesthesia. Reflexes should be absent. Pre-oxygenate the patient if possible. Using the size chart in the pack, select the correct size dog V-Gel according to the head shape and ideal body weight of the dog. Examine the mouth and pharynx of the patient. Remove any foreign materials and suction any excessive secretions that are seen. Lubricate the V-Gel with Vetlube or a similar water-based lubricant. Shake the bottle well and ensure all surfaces of the V-Gel are covered with a fine spray of lubricant. If using a capnograph, attach to the V-Gel prior to insertion. Holding the patient's tongue, insert the V-Gel centrally into the mouth with the airway channel facing the tongue. Gently advance until the V-Gel drops into the pharynx. The correct size V-Gel should fit snugly in place. Confirmation of correct placement should be determined by testing for a patent airway. For example, with a capnograph, gentle positive pressure ventilation, or a respiration monitor. The V-Gel should be secured into place by tying a gauze fabric strip onto the ring features around the device and around the back of the patient's head, allowing no rostral movement of the V-Gel. The V-Gel must be removed from any circuit whilst the patient is being repositioned or rotated. An adequately lubricated gastric tube should be passed through the gastric port of the V-Gel, such that it resides in the esophagus or stomach. It should be gently suctioned at the beginning of the procedure and again at regular intervals, or if material is seen to appear in the gastric tube. Once the V-Gel is secure, the weight of the anaesthetic circuit can be supported by a D-grip tube holder. On completion of the procedure, once normal reflexes have returned, suction the gastric tube and then remove it. The V-Gel can then be removed by gently pulling out of the mouth.